Yes.
Good afternoon, everybody. How are we doing today in this nice, chilly, rainy day? My name is Helen Arteaga Landaverde, and I am the proud CEO of New York City Health and Hospital Elmhurst. Mayor Adams, I don't know, where'd you go? Oh, there you go. I was like, where did he go? He was just here. I welcome you to our beloved Health and Hospital Elmhurst. We're so happy to have you back here. Since this is not your first time, you came here a few years ago for Black History Month, and we were thrilled to have you as our keynote. Welcome back home again.
Thank you.
Many people think you're a Brooklyn boy, but in reality, you're also. But in reality, you're from Queens.
Right.
You actually grew up in our beautiful borough, not too far from here in Jamaica. So welcome home also.
Thank you.
I'm so happy to call you a public health partner, since you fully understand and know the challenge of our communities, especially in this critical time of the pandemic. You know too well what our community is suffering. And for that, to have you here, standing here in our hospital, is very special to us. Thank you for championing the support and the commitment to our health and hospital public system here. And more important, for believing in our mission that every New Yorker deserves excellent quality care. But of course, Elmhurst Hospital wouldn't stand strong if I don't really get to thank the amazing men behind me. I am truly blessed to be surrounded by all these amazing men. Or maybe they're blessed because I'm around. I don't know. I could not stand here strong, or my hospital wouldn't stand here strong, if we didn't have our amazing rock and our amazing leader, Dr. Katz, our health and hospital president. Our beloved David Chosky, our health commissioner, whose visit during the holidays not only made this hospital feel even more special during this holiday spirit, but also made us feel powerful and strong for us to face the pandemic now. And our Queens Borough President, Donovan Richards, whose support is not only a phone call away, but a wallet away as well. And what could I say about my Ecuadorian brother, City Council member Francisco Moya, who was not only born here at Elmhurst Hospital, but who's a constant support and always stands strong with our hospital in the good, the bad, and the ugly. And to my fellow partners in crime, Dr. Mashapur, my chief medical officer, who clinically drives our hospital to be the best clinical place that we have here in the borough of Queens. But also I want to thank my fellow partner in crime, the CEO of our sister hospital in Queens, Health and Hospital Queens, Neil Moore. So on the behalf of our beloved health system, I look forward to working with you, Mayor. I want to ensure you that every New Yorker, and especially the 2.2 million people living in Queens, are here ready to serve you and be ready with your path. We're here not only to serve you, we're here to make sure that our community stay healthy and strong. Mayor Adams, I look forward to hearing your remarks today, and I look forward to a wonderful and long partnership in the coming years to bring health not only to our communities, but to all New Yorkers. Thank you for coming to Elmhurst.
Thank you so much. Really kind of you. I'm going to break a rule. I'm just going to go off script for one moment because we're in the borough of Queens. And so I would love for our amazing Queens Borough President to sort of greet us and invite us to do this on behalf of this great borough of Queens. Donovan Richards.
Well, thank you, Mr. Mayor, and welcome home. We know Brooklyn likes to claim you, but here in Queens County, we know where you grew up, and that is in Southside, Southeast Queens. So I want to thank you for being here, Mr. Mayor. And let me also thank the workers of this hospital, the workers of Elmhurst Hospital, who at the height of this pandemic have not only looked out for this community, but have sacrificed so much. I want to recognize someone who's not with us today, and every time I come to this institution, we pay homage to Priscilla Carroll. We miss you. She, like so many of the workers of this hospital, sacrificed so much, and we lost her to COVID-19, but we want her to know that we miss her and love her. And today we're in here to pay homage to so many people we lost like her in this county. Over 10,000 lives lost across Queens County during this pandemic. And Mr. Mayor, many people ask, why were certain communities impacted? Why were the communities of Corona to Far Rockaway hit the hardest during this pandemic? And the answer is right here. It's inequity is why many parts of this borough were hit harder. Look at our education system, Mr. Mayor, where at the height of this pandemic, children couldn't get their hands on a laptop in this county. Think about food access in communities like Corona, to Jamaica, to Far Rockaway, who did not have simple access to food, to healthy food. Let's look at housing and the housing crises we find ourselves in right across this borough as well. And then you look at healthcare and the disinvestment in institutions for a very long time, from Elmhurst Hospital to St. John's Hospital in this borough. It's one of the reasons why we saw these communities most impacted during this pandemic. There's no simple answer and simple way to put it, but to call it what it is, Mr. Mayor, and that's something called systemic racism and disinvestment once again in these institutions. But I'm happy that you're here, Mr. Mayor, because you're going to find out when you come to Queens County that when you leave here, your wallet is going to be a little lighter. And Helen and Dr. Meshapur, every time I come in here, my wallet is a little lighter. So we're happy that you're here to make a historic investment in many of the institutions across this borough. And as we often say here in Queens County, your socioeconomic status, nor should your zip code be a determinant on whether you have quality health care. The workers of this hospital for a very long time deserve to see investment in this institution. And today I'm happy to invite you back home, and we know that you're going to do a great job as mayor, making sure that those who were considered last in this city will now be put first. I'll just end with a commercial for residents across this borough. Please get vaccinated. We need you to get vaccinated. Now is not a time to be selfish. It is a time to be selfless. Too many people across this system have lost their lives. Too many people have sacrificed time with their families. Too many people have gotten sick because people are not being vaccinated. So we ask you to put our healthcare workers first. They are out here giving it all. We need you to get vaccinated. And I'll end in saying, for those who all of a sudden have become street doctors, all of a sudden they got a PhD in medicine, and not the PhD that Helen or Dr. Chosky has. They have player-hater degrees when it comes to this vaccination. We need you to really be educated and to spread facts as we try to get people vaccinated. So we need you, once again, to put community first, to put our families first, to put our children first. And that takes each and every one of us getting tested and vaccinated. So, Mr. Mayor, welcome back to Queens. We know you will be here often because we demand nothing less in this borough of Queens. So welcome. Thank you once again to our healthcare heroes at Elmhurst Hospital. Thank you to Helen, to our council member, Francisco Moya, and to our health commissioner, our incoming commissioner as well. Welcome. And to Dr. Katz, thank you for your commitment to this entire borough through and throughout this pandemic. Thank you and God bless you. Welcome, Mr. Mayor. I now bring up Mayor Eric Adams.
Thank you so much, and appreciate it. We were here about 2 years ago, speaking at the Black History Month program, and it was a great event. And as we walked in, you stood and gave us an applaud. You don't stand for us, we stand for you. And I'm clear on that no matter where we go. And, people say all the time, this is a difficult job, being the mayor of the city of New York. But I want this job. I want this job so badly because I know that when you are a person that has gone through a lot, you could help people who are going through a lot. And that is what many of you know. I remember over COVID in the beginning, this hospital, and watching you, Francisco, on the ground every day, watching, just struggling to get the services that were needed here. And I was just really honored to come here and assist, but you should be commended for what you did and really sent the message out how these communities were suffering in those beginning days, from testing to PPEs to supplies. But you remained here and you were steadfast. And I thank you on behalf of the people of Queens and the city of New York for what you did during that period of time. And Dr. Mashurpa, 51 years. 51 years. The amount of lives that you have saved and inspired and, children delivered, you are just a real New York City icon and hero. And so we really thank you for those 51 years of services to this community. Started out with one program or one service. Now you've expanded so much. As we would say in South Jamaica, Queens, you're big time, But we thank you. And today we're speaking to all New Yorkers. We're clear that these last few weeks have been hard, but more than that, these last few years, and we're full of fear, fatigue, and uncertainty. And we're all tired. I know that, and I see it every day. I see it on the faces of people. But medical professionals will tell you that the recovery of when you're dealing with an ailment, it's not only a physical recovery, but it's a mental recovery. The climate that you're in, how you're treated, how people engage with you, helped you. That positive energy is so important. And we must instill that positive energy here in Queens and throughout this city. I saw it last night when I was at Woodhall Hospital with other medical professionals, and how, as much as they're going through, they were energized to help people to get through this period. And our healthcare heroes have been working long hours, countless number of days, times away from their family, but they were committed and dedicated. And they're clear, we are going to beat back COVID. We're not going to succumb or allow our lives to be defined by COVID. We're going to be stronger than ever when we cycle out of this period. And I'm clear on that. That's why we're here today at Elmhurst Hospital here, and you're right, my hometown, the borough of Queens, where I grew up from as a child. Our administration has one message: getting stuff done. We want to get stuff done, and the entire team is about doing that. And so today we are announcing a 3-point plan to make sure each and every hospital in the city of New York has the resources they need. We want them to be fully staffed and provide top quality care no matter which borough they're in and no matter where they're located. It is needed across the city. New Yorkers deserve that, and we're going to make sure you have the resources to do so. And so when New Yorkers go to a hospital for care, you must have the services, you must have the support that's needed to provide health care to the greatest city in the world. We must have the greatest healthcare system in the world at the same time. And this is what we're going to do, our plan. We're going to surge funds to every part of our healthcare network. We're going to provide financial backstop for hospitals, healthcare staff, essential workers, and the entire team that keeps us healthy every day. And first, we're announcing a $27 million in loans funding to support our safety net hospitals. Often we forget about the safety net hospitals. They play a vital role in ensuring that there is a net that people can safely know they're not going to fall through the systems. Those hospitals outside our H&H network have been on front lines of COVID, and I see it every day as I move throughout the city. The New York City COVID-19 Hospital Loan Fund will make sure they are getting what they need to fight COVID: salaries, protective equipment, testing, and vaccine administration, and administering vaccines and distribution all over the city. These loans have already funded over 2,400 safety net hospital staff members serving over 26,000 patients. We want to thank Goldman Sachs. This is a good community corporate partnership, and Goldman Sachs should be commended to make these funds available, and we're calling on other financial institutions to do the same, to make sure that it's not just giving a hand clap when our medical facilities are doing right, but giving them a hand so that they can continue to do the great things of financial hands. Second, we are announcing $111 million immediate support for our H&H hospitals. And these dollars are leveraged with what's already going to be leveraged, and part of it is coming from FEMA. When I sat down in Washington, D.C., several weeks ago, I learned that a large sum of resources are being returned to the federal government from various states because they're not drawing down the money fast enough. We are not going to allow that to happen. We're going to make sure every dollar that is located and is directed to the city, we're going to make sure that we use those dollars. We're sending nothing back to Washington, D.C. We're going to make sure it stays in our city. Our public hospitals have been first-line defense against COVID, and these dollars will give them the resources that they need from being hit hard with the pandemic. And these funds will support our hospitals addressing staffing shortages, the major issues on our call this morning, our briefing calls. We know about the staffing issues that we are facing, finding the dollars and the money to ensure that we maintain proper staffing in our hospitals. This is crucial, and we're going to do everything possible to ensure this. Pump up baseline staffing, including doctors, nurses, medical technicians, and support workers. And it will increase the overall COVID capacity and how we respond. Third, expand staffing and support at Department of Health and Mental Hygiene. Part of our ongoing COVID-19 response plan, we want to ensure that the proper staffing is there and the proper support is there. And we know that people are worried about Omicron. We know what it is doing to us, and we know how it has impacted us. But there's only 3 words I can tell you. We got this, New York. We got this. We're going to get through this crisis. And we're going to get through this crisis not only with words, but with support. This is not 2020. This is 2022. There's so many resources we have available. You adjusted, you pivoted, and you shifted based on those early days. We have the right tool to go against the formidable opponent of COVID. Vaccinations, booster shots. We need people to be vaccinated and booster shots. We want to encourage all those, particularly those with pre-existing conditions and comorbidities. They must get their booster shots so that they can fellow protect themselves. And I hear what people say. Well, I have my vaccination, my booster shot, and I still got COVID. Yes, but for the most part, you're home. You're not in a hospital on a ventilator. It's because of that vaccination and booster shot, the numbers are clear, you're less likely to be hospitalized. And that's what we must get out there. You're less likely to be hospitalized, a burden on your family, to infect your family members, to have our cities closed down instead of recovering. So it's imperative that we encourage people to do that, and then do the simple things. Mask up, wash your hands, social distancing. All the things that brought us to success, we have to continue the success. And so I know and you know we're going to show the entire globe that this is the greatest city on the globe. I say this over and over again, it's a privilege to be a New Yorker. It's a privilege to live in this city. And our resiliency and ability to overcome difficult days and difficult times prove why we are New Yorkers. And so I want to thank you, Elmhurst Hospital. I want to thank the team, the staff. I want to thank you for living up to the real mantra of how we provide services for our community, particularly in a community like this, where it's heavily English is a second language. You have many workers that depend on this health care that you provide, And so on behalf of the city of New York, we want to thank you, and let's continue to do what's needed to cycle us through COVID-19. I want to bring up now my amazing deputy mayor that's here of health. She has just brought a wealth of experience and knowledge, and we're so proud to have her on the team and leading this important initiative. Deputy Mayor Ann, I used to call her Annie, and she correct me. Ann Williams Isom. You know, she correct me. She's not Annie.
He got it right. He got it right because he has us working hard. You know how the mayor gets stuff done? He has a team that gets stuff done. It's only been a couple of days, and he came to us and he said he wanted a plan. He wanted a plan that was going to be big and bold, and that he wanted to show all New Yorkers that we were here with them to serve. And so I really want to thank you, Mayor Adams, for giving us the resources. We brought the team together. We got it done. They're here. They will say a couple of words. I'm happy to be here. I am from Queens, too. I grew up in Springfield Gardens, Queens. I happen to be born in Long Island Jewish Hospital. I'm not exactly sure why. My mom was the head nurse there at the time. She came home for Trinidad and Tobago, and she was able to work at the hospital, and so that's where she had me. So healthcare and nurses in particular are very close to me. She's 91 years old now, and she's very proud. And my oldest brother was a pediatrician who died a couple of years ago of cancer. Again, because we have to get the care that we need. So these issues are important to us. I'm so happy to have Dr. Chotsky here to answer any questions that we may have about this 3-point plan, getting the supports to safety net hospitals, making sure that the H&H hospitals get what they need, and of course to the Department of Health, all the supports that they need. So we are so happy to be here today. I'm so happy to see you, and thank you for being on the front lines. And now, Dr. Chotsky, I don't know if you'd like to say the very famous Dr. Chotsky. I don't know, Mayor, did you want to introduce him, or is it okay? Good. Okay. Thank you very much, everyone, and thank you, Mr. Mayor, most of all.
Thank you so much, Deputy Mayor, and thank you, Mayor Adams. I'm going to start with just a brief situational update with COVID-19 because we are seeing unprecedented case counts during this Omicron wave, as you know, over 30,000 cases a day on the 7-day average. And we are seeing the impact in our hospitals like Elmhurst, which I'm proud to say is my amazing neighborhood hospital. Overall, COVID-19 hospitalizations in New York City are currently less than half of what they were during our initial spring 2020 wave, though they have surpassed what we've seen in other waves. When we look at the total COVID and non-COVID census, it has been stable over the past month. About 75 to 80% of all hospital beds across New York City are occupied right now. And that number we do expect to increase in the coming days. This is why it is so vital for us to surge resources and support to our healthcare system, particularly to our safety net and H&H hospitals, and continue to support our COVID-19 response during this time. We'll also, as the mayor mentioned, be shoring up our public health infrastructure with 250 critical positions at the health department supporting our COVID-19 response. This includes nurses, laboratory personnel, case investigators, inspectors, and data analysts. We have a saying in public health that it is often invisible. You may not know the names of the people who work at my department, but they have saved countless lives over the past 2 years, perhaps including yours. In addition to supporting our city's public hospitals, as the mayor has mentioned, we're relaunching the Hospital Loan Fund for our safety net hospitals. That's $27 million that will be available to them. Supporting these hospitals is not just about health. It is also about equity, as the borough president described very eloquently. Black New Yorkers are currently being hospitalized at a rate over 2.5 times that of white New Yorkers. But let's be very clear, the risk factor is racism and not race. New Yorkers of color have borne the brunt of this pandemic due to structural racism and the legacy of disinvestment in many communities. So today's announcement is about the mayor investing in hospitals and neighborhoods like this one, my own, in order to help redress these historical inequities and to save lives today. So finally, I want to stress that there are things that all New Yorkers should do to support our nurses, doctors, and other healthcare workers who are once again coming to the rescue. Vaccinate your child, get your booster dose, wear a high-quality mask, and look out for those who are more susceptible to severe COVID, whether an older adult or someone with a chronic condition. If you're already doing all of these things, I want to sincerely thank you, because you're not just protecting yourself, but also our hospitals and our health workers. Together, as the mayor said, we will weather this Omicron wave, and we will build a stronger and long-lasting health infrastructure. Thank you so much.
Thank you. Thank you. Thank you. I want to bring on just someone I have a deep level of respect when it comes down to not only acute injuries, but chronic diseases. And I look forward to his leadership at H&H, Dr. Katz.
It's great to be with the mayor 2 days in a row, 2 hospitals. It shows his high level of focus and energy around making sure that we get all of the resources that we need. And his announcement of $111 million is going to pay for us to have additional support staff, doctors, nurses, radiology technicians, microbiologists, and all the staff that we need to get through this crisis. I mean, sir, when we're here at Elmhurst, you'll never find a public hospital with a better medical, nursing, all-around staff than here. A hospital more committed does not exist. This hospital's whole reason for being, its whole soul, its whole mission has been to serve the immigrant communities, the black and brown communities, the low-income communities, and provide the highest level of care to everyone. And that's what this hospital has always stood for. And Mr. Mayor, I can tell you that they have been doing that, working really hard these last few weeks. Because of Omicron, the way it has hit us, this cycle very different than some of the other cycles where our number one problem has been, in this cycle, the loss of staff. All right, there's nothing about being a nurse or doctor that makes you immune to Omicron. And many of us have fallen down because of Omicron, but we get ourselves back up and we come back to work after our isolation period, and that's what's been going on here. And so this additional staff will make a huge difference, and we're incredibly grateful. I'll tell you that as difficult as it is, thank God it's not like, Jasmine, remember that morning, right, when we first knew something was amiss, 2020. I get a call from the then CEO that 16 people had been intubated in Stu's emergency department in a 2-hour period, something that would normally never happen under any kind of circumstances. At one time, Stu, I also remember when you had 100 intubated patients in the emergency room, all at one time. So we got through that. We are Elmhurst strong. We're health and hospitals strong, sir, and you can count on us. Thank you so much.
Thank you. And I think it's imperative to see our new Commissioner of Department of Health and Mental Hygiene. I'm glad to see him here, and he has been a real partner with Dr. Chosky, and so we look forward to that. I just want to bring Dr. Oswin at this time.
Hi, everyone. I'll be brief because I didn't know I was speaking until just a minute ago, but it's an honor to be here. Most importantly, it's an honor to be here in front of all of you, folks who are on the front lines combating this pandemic every day. As a practicing primary care physician myself, I have some taste of what you're going through and what you've been through. And I'm very proud to be a part of an administration that is making investments in quality of care and in the infrastructure and supplies and staffing that you all need to do right for your patients, which is, I know, why you get up every day and why the doctor has been here for 51 years, because you care about your community, you care about your patients. And this is an investment in your ability to do the work that you're the experts at this most critical moment. But I also want to highlight, and again, why I'm so proud to be joining this administration, is that this is more than an investment in healthcare alone. This is an investment in the relationship between healthcare and public health, knowing that those are intimately linked and they go hand in hand. And the work that we do to address this pandemic through data, through prevention, through policy, and through frontline distribution of vaccines and care goes hand in hand with the work that's done at fantastic facilities like Dr. Katz's and all of yours, including this one. So I'm just very grateful to be here. I'm grateful to be in partnership with Dr. Chokshi during this transition phase, grateful that he agreed to stay on during this most critical moment, and I know he's just done an incredible job during this pandemic. And I look forward to spending more time with you, and thank you to the mayor again.
Thank you. Thank you. So before we open it to questions, we have to go to the councilman who was a baby boy in this hospital, born here. You know, just he's like a superstar when he comes back in the building. Councilman Francisco Moya.
Thank you, Mr. Mayor. Thank you. Thank you. Speaking of home, good to be home again with everyone here. Look, I think everyone has really summed it up correctly about the power of the work that all of the people here at Elmhurst Hospital have given. You've dedicated your lives to the betterment of this community. This was the epicenter of COVID. Working with Dr. Marshapur, with my Ecuadorian sister here, Helen Arteaga, who has done a tremendous job, and all of the staff. I just want to say one quick thing. I came to get my booster shot around December 20th. And I came around 6:30 in the evening. And I asked Edwin, he's a nurse that's over there administering the booster shots. And I asked him, I said, look, there's lines, you know, around the block. I said, how's it been? He goes, you're my 700th patient that walked right through here. In one day. And what it's saying is that the place that was the epicenter of the pandemic, we are now seeing that we are above that 80% of people that are now vaccinated. And it is because of the work that you all do. The fact that you have been promoting the importance of getting the vaccine, about getting the booster, is what's turning this thing around. You truly are the champions that will lead us through this tough and difficult time. But I have to say thank you to the mayor, because I've always said this. You show me a person's budget, and I will tell you, you can tell where their priorities lie. And the fact that the first thing that he's doing on his first week as mayor is coming to the hospital that was most impacted by COVID and saying, we are not going to allow this hospital or our hospital system here in the city of New York to go through what it went through again. And in a borough of Queens that has seen the loss and closure of over 9 hospitals, the reliance of the public on our public hospital system is taxed now more than ever. The relief that is coming now is going to help the future of this community, the future of this city. And I cannot thank you enough, Mr. Mayor, because it isn't not his first time here. It is the moments that count that this mayor is standing strong with all of the people here at Elmhurst Hospital and in this borough of Queens that says, thank you, Mr. Mayor, for this investment that you're making here, and thank you for helping us get through this process. Thank you so much.
I'm going to take questions on topic first. On topic. That's it.
Dr. Chokshi, is the city doing citywide surveillance testing? If not, why not? And if so, how do those results compare to the on-demand test results that you're seeing?
Thank you so much for the question. Yes, our surveillance testing is taken from all of the tests that are done citywide. Essentially, we have sampling based on both our city sites as well as results from non-city sites that allow us to track what's happening citywide as well as in a borough-specific, zip code-specific, and often a neighborhood-specific way.
And how do they compare to just the overall positivity rate? Is it the same, different, and if it's different, how?
That is the overall positivity rate. We do see differences, based on those geographic units that I've described. All of this is at nyc.gov/COVID data to see how positivity rates are changing over time. What we're seeing overall, I can tell you, which remains a good tracker of what's happening with infection related to the pandemic, is that we saw a steep increase, as you know, over the course of December, and particularly in the last 2 weeks of December. We are seeing some leveling off of that just in recent days. It's a little bit too early to tell whether that's just due to holiday testing patterns or a real leveling off in cases and positivity.
Just one quick follow-up. So the positivity that you report every day is the surveillance, not just the overall number of positivity?
We consider surveillance testing to be what we report as the positivity rate.
Nolan?
A couple of questions related to this specific announcement. The $27 million for the charity hospitals is coming all from Goldman Sachs, or is that Goldman and FEMA, or what's the exact pool of money there?
You should do that one.
Sure. Yes, the $27 million is a hospital loan fund, and it is all from Goldman Sachs. The way that it works, which was something that we had done earlier in the pandemic, is for safety net hospitals who need the liquidity that a loan fund can provide. It gives them that resource flow so that they're able to make the investments which are critical right now, whether it's staffing or equipment or other needs for resources. In many cases, those expenses will be FEMA reimbursable, but what matters is that we're able to channel those resources, thanks to Mayor Adams, to safety net hospitals right now.
For the $111 million to health and hospitals, is that all from FEMA, or is that partially from city money, and is that in addition to or part of the usual, $1 billion subsidy that H&H gets?
So it's not part of the subsidy. What it is that the mayor has given us approval to spend that amount of money to hire immediately the nurses, additional providers, support staff that we need, and then we'll work together with City Hall to try to get as much of it paid by FEMA as possible, reimbursed.
And the 250 positions for DOH, is there a price tag for that?
For DOH, that's you.
It's budget neutral. These are positions that were previously allocated for in this fiscal year's budget. What this allows us to do is to act on that right now, where it's particularly important to surge the types of resources that I've described.
For Dr. Chokshi, you talked about maybe we're seeing a leveling off of infections. Obviously, the numbers have been climbing over the last several weeks. At what point would you estimate, based on the numbers, that the wave sort of crests and we begin to turn the corner?
Yes, well, I've answered these questions hopefully with a lot of humility in the past, because it is very difficult to predict with any degree of certainty. With that said, we are following the trajectories from places like South Africa and the UK, and based on the shapes of those curves, as well as what we're seeing in our own data, I'm hopeful that we will see a peak before too long, meaning in the next few weeks, and I hope within the next 2 to 3 weeks.
I wanted to ask Dr. Katz, I heard from some staffers here and in other H&H hospitals that there's like a 48-hour turnaround for getting results back of COVID tests, even for people working directly with COVID patients. And there was some concern that because of that, they had to call out, they didn't get their test results in time. So is there any effort, if you want to speak about the effort being made to protect the workers here, especially at a hospital like this, and then what is that turnaround time?
Sure. Absolutely. Well, first, we're very proud that we're currently doing testing health and hospitals through the T2 at 200 different sites, 100 brick and mortars, 100 mobile sites, 50,000 tests a day are being done by health and hospitals T2. The current average for getting a test result is 24 hours. We have had some ones that went to 48, but of course that's what an average is. Right, so we haven't had anywhere near, whenever anyone has called me and said that they waited 4 days and I followed it up, it was a private source. So we're able right now, average 24, the outliers are 36 and 48 hours, especially at times when demand goes up. But
availability for rapids for especially workers, employees working directly with COVID positive patients, or is that?
You mean doing a rapid test as opposed to get a rapid result?
Yes.
Okay, so I mean, we are focused mostly on the PCR because of the higher sensitivity and specificity, especially around healthcare workers, where we feel we need a definitive answer. So I'm a big believer in people going out and buying home tests, and especially serial negative tests are incredibly reassuring. But for healthcare workers, we want to do a PCR. Thank you.
Michael?
Thank you. So on the funding announced today, the $111 million and the $27 million loan, can someone tell us specifically which hospitals each of those kind of buckets of money will go to? And on the loan, can someone give us some more details on what the terms of that loan are, the repayment schedule, that sort of thing?
So I'll do the health and hospitals, and I'll turn to my colleague for the loan repayment. So what we're aware of is how hard our doctors and nurses and other support staff are currently working and how stretched they are. Stretched because so many people have been out due to Omicron, and stretched because of the demands of taking care of so many patients with Omicron. So what we will be using the money for, basically, we fill in wherever people are out. So the money basically forms a health and hospital pool. And for example, of some of the earliest nurses we've been able to bring in, they went to Coney Island Hospital because that was where we were hardest hit first. Coney Island has a large number of senior residences that are all around it, and so more vulnerable people. So the money, we basically use the money to hire the additional staff, and we send them to whichever hospital is most hard hit based on ratios.
And on the $27 million loan fund, when we say it's targeted to safety net hospitals, those are hospitals across New York City who predominantly serve low-income patients, usually patients who are on Medicaid or uninsured. Some examples of those hospitals are, for example, the hospitals that are part of the One Brooklyn Health system, like Brookdale Hospital or Wyckoff. And our team can follow up with a full list of the hospitals that are eligible for that. Did that answer your question?
The CBS radio, I'm gonna go out.
Sorry, just briefly on the terms. I'm a simple doctor, so I will have to defer to my budget colleagues on that, but I'm certain we can follow up on it.
Just more of a COVID situational update type of questions. For Dr. Katz, how taxed is staff right now at hospitals, and what measures are you taking? For Dr. Choksi, what are you seeing that leads you to believe we could be reaching that crest right now in terms of the city data?
The worst days for us were definitely Sunday because it combined multiple things. The high rate of Omicron coming in, the day after New Year's Day. Sundays are always more difficult to staff, more difficult to discharge. And so the ratios for the number of patients to nurses were way in excess of what we want. By today, things are already way better because of additional staff. Our wonderful chief nursing officer, Joanne, was telling me that today at Elmhurst, it's one nurse for every 6 patients on the medical surge, which is not, we aim for 1 to 5, but that is in the realm of reasonable and way better than we were doing on Sunday.
Bringing any reinforcements?
Yes. And again, we've been targeting them to the places that are most hard hit. So Coney got the largest number, but we did send people here as well.
And before you answer that question, Dr. Choksi, trust me, he did not say he knew when this was going to conclude, because they would do a front page headline saying, "You said it's concluded." He did not say that. We don't know. If he knew, we'd all be billionaires right now. So let's be clear. He did not say that. We're all hoping. You can answer on your own, but I just want to be clear on that. Trust me.
That is much appreciated, sir. And that's exactly right. So let me start with what we know from the data that we're seeing, which is cases are increasing and hospitalizations are increasing. I expect that will continue in the near term, meaning the next days to weeks. What we are looking for is a deceleration in the rate of growth. And we're not seeing that yet, but that's what I'm looking for in the data for us to be able to say that we may be approaching the peak in the coming weeks. But there's one other thing, and I think, Mayor, you'll appreciate this as well, which is this is not something that New York City is just experiencing passively. This is not something that is just happening to us. This is something that we have agency over and that we can control through the things that the mayor has talked about and that we have tried to emphasize, particularly vaccination. Booster doses will help, particularly for those who are more vulnerable, more at risk of severe disease. Masking, testing, ventilation, distancing. If we bring all of these things together in concert, then we can shape our destiny and shape at least part of the curve that we'll see over the next few weeks. Thank you.
Clarify, you did say earlier that you were seeing some of these early signs that the crest could be approaching. I know we don't want to, drop the balloons and celebrate too early, but what are those early signs?
Certainly, yes. So in the last few days, what we're seeing is that the steepness of the curve is not quite as much. But what I wanted to emphasize is that could be due to the changes in holiday testing patterns. Less people are getting tested over the holidays. And so we'll have to follow that out over the coming days to understand whether that is a real phenomenon or something that is related to changes in testing patterns. And one other reason to strike a note of caution is that we do know the other thing that happens over the holidays is there are more gatherings. We saw an increase in the number of cases at the time that you would predict after the Christmas break based on the incubation period of the virus. We are still just a few days out from New Year's weekend, and so we should anticipate some uptick related to social gatherings around last weekend as well.
Two questions for Dr. Choksi. One is about the FDA approving the boosters for kids 12 to 15. When will the city roll that out and launch a campaign? And the second is on masks. I know you've issued an advisory or urged New Yorkers to wear higher quality masks. But for example, everyone on the stage today is wearing a different mask. Could you be more specific about what you mean by a high quality mask? And how often do they have to be disposed? Can they be washed? And what kind of masks are children and teachers getting at public schools?
Okay, thanks. There's a few questions in there. Let me do my best. So on the first question, booster doses for 12 to 15-year-olds. As you said, Liz, the FDA authorized this on Monday. The CDC's advisory committee is meeting to review the data and deliberate on it, I believe, as we speak. And based on their recommendation and then the CDC director's approval, which will likely happen sometime tonight at the earliest, perhaps tomorrow, that would be the full green light for New York City and other places to actually be able to administer booster doses for 12 to 15-year-olds. So all of that taken together, Friday is likely the earliest that booster doses for 12 to 15-year-olds will be available. With respect to masks, yes, we have advised New Yorkers to use high-quality masks. Generally, this means if you're wearing a cloth mask, we advise you to upgrade it to a surgical mask, which is the type of mask that I'm wearing, or a higher grade mask like a KF95, a KN95, a KF94, or an N95, which some of my colleagues are wearing. Some of this depends on your individual level of risk and vulnerability. Some of it depends, of course, on your personal comfort level as well. But what we're advising is for everyone to think again about the mask that you're wearing and to consider upgrading it to a higher level of quality. With respect to children, look, I'm a father as well as a doctor, and I take a pragmatic view on this, which is the best mask is the one that your child will wear consistently. So that's the most important thing. And with that said, the same logic applies. There are higher quality masks. Layers and fit are particularly important, and sometimes fit is a more difficult thing in children just because they have smaller faces. So we want it to be snug against the sides of their face and to have multiple layers, meaning 2 or 3 layers, if at all possible.
How often would you reuse the masks?
This also depends a little bit on the type of mask that you're using. Most masks can be used for several days at a time. In other cases, people who use disposable masks may change it every day. Since we're no longer advising cloth masks as strongly, those are the most reusable. So what I would say is look at, the label for the specific mask that you have. Change it in a cadence that is common sense based on the mask itself.
Last two on topic.
Dr. Choksi, is the number of COVID positive hospitals... I'm sorry, Mayor. Is the number of COVID positive hospitalizations a bit misleading? I spoke with 2 experts today in the city who say, look, only about a third of the patients who are COVID positive hospitalizations actually have COVID. They're in the hospital for appendicitis. They happen to test positive. Are we scaring New Yorkers by saying hospitalizations, COVID positive, are spiking when the actuality is the acute COVID hospitalizations is not as big as we're making it sound?
Thanks. This is important. I'll ask Dr. Katz to also speak to what he's seeing at health and hospitals. The short answer is no. I don't think that we're that we're scaring New Yorkers in terms of what we're conveying. We do have to look at all of the data together. So we have seen this steep increase in COVID hospitalizations, as you pointed out. We're also looking at the total census, which is what I had mentioned in my remarks, which remains quite stable over the last few weeks. So what we're seeing is that non-COVID admissions are not increasing, and in some cases are actually declining even as the COVID admissions are increasing. But what's the reality is that our hospitals are under some degree of strain right now, and it's compounded by the staff outages because of COVID infection related to Omicron. So we're following all of this together. What we know is that COVID-19 hospitalizations are increasing. The degree of severity is somewhat less than what we have seen in prior waves, but we are seeing ICU hospitalizations increase as well. So taken together, something for us to take seriously. That's why we're here making the announcements that we are and advising the steps that we have. Dr. Katz.
Yeah, I just added, I think it really is an all of the above. So absolutely, as you would expect, because there's so much community transmission, we've had people, car accidents, COVID positive. Coming to deliver a baby, COVID positive. So absolutely, there are people who, as part of those hospital statistics, who are COVID cases. There's also a large group of in the middle. So someone has underlying lung disease and they have heart disease and their baseline is a little short of breath, and then they come in with worsening shortness of breath and are COVID positive. So where COVID is really probably a contributor in and of itself, it wouldn't bring someone into the hospital. On the other hand, if they didn't have those other illnesses, the COVID wouldn't bring them in. So it's all of the above. Thank you.
Last on-topic question.
This one's for the mayor. Hi, Mayor.
How are you? First of all, those are great questions. And your question, we're going to do an analysis over what information we're putting out there and how we're putting it out there. I'm a visual person. We're going to do some form of video showing the mask, showing how to put it on the child, the proper fit, what's a different type. So we want to boost up how we're giving information in a simple way. And we should do it in multiple languages. So I'm glad you asked that question. And we're going to put in place some type of simple video that can show people how to do it. And even a simple video take-home test. Like I said, when I opened that box and read those instructions, I said, forget about it, I'm sorry? Yes, I am. I'm going to do the video, but I'm glad you asked that question, and we're going to roll that out, all right? Deputy Mayor? Mm-hmm. Yes.
So I got a new statement from DC 37 yesterday. They are calling on you for a telework policy for non-essential workers. Have you spoken with Henry Garrido about this? Is this something you're considering?
No, I haven't, and I'm going to call Henry. I'm surprised he reached out to you and not me, you know. Okay. So I'm going to call Henry and find out. During the time of being in the borough president's office, I had a work from home policy. Those who were able to do it, others came in. And so I will speak with Henry and find out exactly what he's looking for. But, I'm a big believer that we have to get the city up and operating. It's important that we get back, function as much as possible, because we don't know if there's going to be more strands. We don't know what the future holds. And I just really want to get us mentally ready to get our city up and operating. So I'm going to speak with Henry and I'm going to find out what his suggestions are.
We're going to take a couple of off-topic questions. Katie?
Me? Oh, sorry. Mayor Adams, you met me, right?
Yes.
My question for you, Mayor Adams, and it's about Serena Townsend, who is the Department of Corrections head of investigations. A federal monitor overseeing the Correction Department had said that she was critical to the success of this reform effort moving forward, but she was removed by the newly appointed Department of Corrections Commissioner. If you're trying to reform that department, why get rid of her? Do you know what happened with that?
It's crucial for me to appoint people that are capable and then sit down and allow them to put together the team that they want to implement a very aggressive plan. They sit down in consultation with me, and once they lay out, this is why I'm making these personnel changes. If it makes sense to me, I'm going to follow through and allow them to execute their plan, because I'm going to hold them accountable like New Yorkers are going to hold me accountable. We have to move the needle in the Department of Correction. That is an important place for me. And if my Commissioner Molina stated, Eric, these are the personnel changes I need to make, I'm 100% in after he sat down and shared it with me, and I'm with him.
So he shared with you before he fired Ms. Townsend that he was planning to do it?
Yeah, without a doubt. Every member of my leadership team, they sit down, they explain the movement they're going to do, why they are going to do that movement, and we go through it, personnel by personnel, line by line, and I look for a reason for that, to build that team. And he sat down, he says, this is the reason he came in. He had a clear presentation, a very impressive one. He laid out his plan, and at the end, he said, this is the personnel I must remove at this time for my first wave, because there's going to be another wave of changes in that agency. He said, this is my first wave. I'm going to go in and do another analysis, and I'll come back to you again. So I told all of my agency heads, my deputy mayors, I need for you to give me your plan, tell me what personnel you need, who you need to move out, so that you can execute what you need to accomplish, and he did that.
What was the reason he gave for?
I can't share those type of conversations. I'm gonna lose the integrity of my office.
Mr. Mayor.
Yes, sir.
To continue on the line of questioning, experts say that COBA is one of the biggest contributors to the dysfunction out on Rikers Island. The union is accused of attempting to organize a sick out. Your new jails commissioner has liberalized the sick leave policy, and now we have the sacking of the federal monitor's internal affairs person. Mm-hmm. What do you say to people who look at these changes and say you're rewarding bad behavior by the union?
Well, one thing is for sure. When I ran, I clearly pointed out that DOC is a focus area for me. That level of dysfunctionality is unacceptable, and the people of this city will judge me at the completion of my time as mayor to determine did I live up to my campaign promise. No matter who's assigned there, the people of the city is going to say, did you fix the problem? That's what they're not going to look at who was, as you said, sacked or who was no longer there. They're going to ask me one question: did you fix the problem? That is all I'm focusing on. I appointed a commissioner. I told them what I wanted done and with the conditions I want on Rikers Island and all of the facilities. We focus on Rikers, but all of them. And he is going to execute that plan. And so I'm hoping that New Yorkers trusted me when they elected me. I'm hoping they trust me as I staff up with the right personnel.
Last question for Michael Della.
Mr. Mayor, there was an op-ed recently by the former police commissioner Dermot Shea, and he was talking about reforms to the discovery process. And he suggested that these reforms have slowed the process down in the courts for prosecuting accused criminals. Do you have plans to revisit that? Do you think that's something that's worth addressing? Also, what happened to your finger?
I love that guy. You know, yesterday, I don't know how many of you were there at the press conference yesterday that Eric Gonzalez had. That was such an eye-opener for me. And to see those videos of dangerous people, gang members, just committing arrests, crimes, and how when he took down 3 violent gangs, the shooters in Brooklyn just dropped. And this was the 4th one that he took down. But also the videos showing what they were doing, total disregard. And I asked him, I said, Eric, I need for you to do this entire presentation to my state and city and federal lawmakers and have us re-examine some of the legislation that we have passed and do it in a cooperative fashion, not in a fashion that we're going to be at each other's throat, but just see the real data. And I think that with the Commissioner Shea, his Shea's op-ed, and what others have been saying, it's time for us to come to the table and sit down and say, what are the new rules or new legislation we're passing? What's the impact of that? One of them, I believe, is when we look at raise the age. Do you know if a young person is caught with a firearm, and that firearm is not in public view, he is going to go down to family court, even if he had previous cases. We had several cases that just unbelievable. A young person handed a firearm to someone to commit a robbery. A young person shot himself, the same person shot himself in the leg walking down the street, and the gun was caught on him. The same young person let off a gun inside his apartment that went through the roof of another, that went through the ceiling of another. But the judge he could not do anything but to bring him back to family court. Something is wrong with that system. And so I think we need to look at what we have done and have an alignment to make sure that we're not creating an environment that's dangerous to everyday people. Give the help to these young people, but we cannot continue to create this dangerous environment. And we need to re-examine everything we have done and do an analysis that should we stay on this pathway or should we do something differently?
And your finger?
Oh, this is the strangest. Well, first of all, thank God it's those 2 fingers and not the wrong finger. But I shook someone's hand and I felt an electric shock in my little pinky, and it just went misaligned. And when I went to the doctor yesterday at Woodhull Hospital, another great hospital, they did an X-ray, and they stated that it wasn't broken, that it would just heal. And since I'm a former athlete, I just put some tape on it and just be hardcore, huh? One of the chiefs and the first precinct. One of the chiefs in the first precinct.
So before everybody goes, just 1 second. So Dr. Katz, Dr. Katz and I want to give you something, just to welcome you to this cool club that we have here at Health and Hospital. Empanada.
Oh, man. Love it. Love it. Love it. I am loving that. Let me make sure I get the right size so I can give me the right size while I'm here. And, you know,
It's Elmer Strong on the back there.
I'm a big neck person. I love anything that goes up to my neck. You know that?
did you?
Thank you so much for coming. Thank you.